Hello, so my name is Lauren Garay, and I'm going to be presenting on Chapter 14, Mental Health. So, according to the textbook, defining a psychological disorder has always been a challenge for psychiatrists and clinical psychologists. Disorders are described as rare behaviors that cause impairment to individuals. Defining mental health conditions can also be very difficult because certain behaviors can be viewed as problematic in one culture but not in another. Cultural differences in mental conditions demonstrate that we cannot simply believe that they are natural. Human biology is similar in different cultures, yet psychological disorders present themselves differently all around the world. Due to this, we can conclude that culture is involved in the way people express and experience mental disorders. So, an example of a disorder that is unique to a culture is hikikomori. This disorder is not seen to be universal and is specific to the Japanese culture. Hikikomori translates to social withdrawal and is characterized by the absence of social interaction outside of family members for at least 6 months. This first appears in young adolescent Japanese students that are mainly boys when they decide that they do not want to go to school anymore and do not want to have any social interaction outside of their home. Even though hikikomori-like symptoms have been seen in other cultures, the exact characteristics of it are unique to the Japanese culture. So, as stated in the textbook, a culture-bound syndrome is a group of psychological symptoms that appear to be greatly influenced by cultural factors and therefore they occur less often or are manifested in other cultures. One example of this can be DAT syndrome, which is a disorder that is frequently observed in several South Asian cultures. It is characterized by a belief among men that they are leaking semen, which causes them to be severely anxious. This is an example of a culture-bound syndrome because this might not occur if they were not in that culture or in that environment. So, eating disorders. The two most common eating disorders that have the same characteristics cross-culturally as well as within cultures are anorexia and bulimia. Anorexia nervosa is characterized by refusal to maintain a normal body weight, a fear of gaining weight, and a denial of abnormally low body weight. Bulimia nervosa is characterized by recurring episodes of binge eating along with inappropriate behaviors to prevent weight gain. There is evidence that bulimia and anorexia are more prevalent in Western societies than in others. Universal conditions. There are many psychological disorders that can be seen as universal, such as depression and social anxiety. Depression is characterized by persistently depressed moods or loss of interest in activities, which causes an impairment in daily life. Social anxiety is characterized by social interactions causing irrational anxiety. These mental health conditions are seen in different cultures, however, the manifestations may be different. And last but not least, these are my references, and thank you so much for listening to my presentation.